Hi guys. I'm going to talk a little bit about today and sort of how I felt in my lecture and lab earlier today. And I'm going to talk also about the way that it's sort of connected to my personal life. I don't remember, we were talking about mental health stuff, so it was really relevant to my life. And I don't remember feeling this way before, the way that I'm about to explain to you guys. But maybe I have felt this way before because I did do my previous degree in psychology. So there were many times I'm sure that we were talking about people with mental illness, and I felt like there were correlations to my life. But anyway, the feelings I felt today, I felt like they were new and they were really uncomfortable feelings. And yeah, so I just kind of wanted to talk it out, because I don't have people in real life really to talk about stuff with. So anyway, so I'll tell you guys what we were talking about. So I'm in a pediatric / mental health class this semester. So the first 6 weeks we talked about pediatrics, and then the last 6 weeks of this semester we're doing mental health, and learning about psychiatric nursing and stuff. So the last 6 weeks of this semester started today. So today was our first time in the mental health lecture and corresponding lab. And we were talking about I don't know. Okay, well, one of the first things that we did is we have this online tool that we use in our classes where the professor will ask a certain question. This isn't just for this particular class, but it's for a lot of my classes. The professor will ask the class a certain question, and then we all text in our responses, and then we get we can see the answers as people text them in. We can see the answers on the projector, the screen in front of the classroom as people send their responses in. So today the professor, just as an introduction to the class, I guess, she asked us to write a couple words, 2 words, about the first things that came to mind when we think about mental illness. And so the first thing that came to my mind was distorted thinking, because I know that's it's a common symptom of a lot, if not all, mental illnesses. And other people wrote things like stigma and isolation and loneliness and shame, and someone wrote a couple of people wrote things that weren't kind at all, but I think that they were genuine, and that those people did think those really nasty things that they wrote about people with mental illness, so they were genuine, but they were really not kind. And I hope that their view of people with mental illness changes during this course, but because they're not right now, they're not somebody that I would want to have as a nurse. But anyway, some of the things that the people wrote, including those things where people wrote disgusting and stupid and stuff, which is just really unkind things that shouldn't be said about anybody. Other people wrote isolation and shame and stuff, and I don't know, some of those things maybe it's not bad that they wrote those things, that that's what they think about when they hear mental illness, but it made me feel kind of sad because not all people with mental illness experience isolation, and not all people with mental illness experience shame. And I don't know, I mean, overall the experience, it wasn't horrible for me, and it was nice for me to see what my classmates thought about mental illness, but it just sort of I don't know, like more bad stuff was to come. So this was just sort of like one little bad thing, and then it just sort of built up over the rest of the course, over the rest of the lecture. Then the professor was like talking about like very basic stuff, like about mental illness, because like this was our first class, and it's kind of frustrating for me because because my previous degree is in psychology, so I spent like 4 years learning about mental illnesses, and like now we're like going back to the basics, so that's frustrating. But a lot of the people seem to not have like a good understanding at all of what it's like to talk to somebody with a mental illness. Like during the discussions in class today, like it just, some of the comments that people like came up with, like I don't know, it sounded like clear to me that these people hadn't talked with somebody who had a mental illness before, and like they have these like preconceived notions, and I don't know, like it just made me really uncomfortable, and like it made me want to like for sure never like divulge to them that I experience a mental illness, because like their perception of me might change, and I think that it's really sad that it's that way. But like mental illnesses are still really, really stigmatized, and I would like to help break the stigma by talking about my experiences with mental illness. But then when I hear people talk about mental illness the way they did today, like I want to educate them and stuff, but it also makes me kind of like not want to tell them that I have a mental illness, because it's clear they think so badly about people who do this, so I don't want like their perception of me to change. Anyway, it sort of made me sad. And then in our lab, one of the main things that we talked about was what happens like from the nurse's standpoint when a patient is like needs to be admitted to the hospital, but they don't want to stay. So like what sort of criteria have to be met for the patient to be able to be kept at the hospital involuntarily. So we learned about like the mental health laws, and we learned about like the different documents that have to be signed by the doctor to like put these the whole process in motion, I guess, of like when a patient I'm having a hard time explaining this, like I always do, like I just like have a hard time talking and with words and stuff. But when a patient is admitted to the hospital, if they're at danger of hurting themselves and or danger of harming others, and or are unable to take care of themselves, like at a very basic level, then after they've been assessed by a doctor, it doesn't have to be a psychiatrist, any doctor, they can be kept in the hospital involuntarily. And so like there's like a name of that document, like we call it a form, and there are like different numbers for like different forms. So we were learning about the different forms and how long each of the forms is valid, and like if a certain form has to be renewed like a certain number of times, then another form is like brought into play, and it's like really confusing. Like there are a lot of different forms and different numbers and stuff. So we spent a really long time learning about these forms because everyone was like confused and stuff. So we spent a long time on it. And the person, like the nurse or educator who was leading the lab, she never talked badly about patients, but when we were talking about the forms, we never really talked too much about the patient. Like the focus was on the forms, and like which form do you give to the patient, like in this scenario. When the nursing educator was talking about that stuff, she never talked about the patient and what like the patient might feel when being like kept in the hospital involuntarily. And I understand that wasn't the point of today's lab. The point of today's lab was that we understood the different forms, and in future labs we will focus on the patient and how like as nurses we can build trusting relationships with psychiatric patients and build rapport with them and all that stuff. Today, that just wasn't the focus, but it made me, like, it brought back memories of times when I've been on forms. And, like, yes, I've been admitted to the hospital before involuntarily. And one time, I think it was, like, for my own good. And even at that time, I thought that it was for my own good. But then the 2 other times, I think it was 2 other times, total of 3 times, but 2 other times I was put on a form and I didn't think that I needed to be on a form. I thought that the doctor was, like, sort of abusing her power. And I don't know, like, all this talk about forms today made me think back to my own experiences of being on a form. And it just, like, brought back all those negative emotions of those times when I was doing a lot poorer in terms of my mental health than I am now. Like, times when I was depressed and suicidal and engaging in, like, really serious acts of self-harm. Not to say that some acts of self-harm aren't serious, but I mean, like, physically serious, like needing stitches or something. Yeah, like, I don't know, like, I just had experienced so many emotions today, like, in the middle of lecture and lab, and I couldn't really leave. I mean, I could have left, but I didn't feel like it was, I felt like I would be worse off if I left than if I stayed in the lecture, because at least if I sat in my seat, nobody would tell that I was, like, sweating and I was, like, getting really cold and stuff, because that's what happens when I'm, like, really anxious. At least if I sat in my seat, I could suffer in silence and nobody would know. But if I got up, well, I wasn't sitting near the door in lecture or in lab, so I'd have to, like, walk in front of people, and, like, it might cause a little bit of a commotion. And then, like, people might wonder, like, why did I leave? Like, was it because, like, I had been on a form before and, like, I was gonna go off and cry somewhere? No, I wouldn't have gone off and cried, but, like, there's always that thought in the back of my mind, because I do have social anxiety, of, like, and the thought is, what are other people thinking about me? And since I can't really ask people what they're thinking about me, I jump to my own conclusions, I guess, and I decide what people are thinking about me. And yeah, so I was, like, sort of sitting in my seat, just kind of, like my palms were, like, sweaty and stuff, and I was cold, and it was hard for me to, like, take notes because my pen kept, like, slipping through my fingers because my hands were so sweaty, which is really gross. And I don't know, like, it just, I think it's, I don't know, like, I'm trying to say something, I don't know how to say it. I don't really want any of the people in my class to become psychiatric nurses, because they don't know what it's like to be a psychiatric patient. I mean, some might. I don't know, like, if other people in my class have been patients in a hospital because of a mental illness. Like, I have no idea, but I don't know. Like, I don't want, like, these future nurses who are my classmates, or, you know, not even just my classmates, but I don't like the idea of any nurse and, like, doctor putting patients on involuntary holds to hospital, because they don't know what it feels like to be the patient, like, to be on the other end of it. And it's just, like, it's horrible, because when you're a patient on an involuntary hold, you're supposed to still have, like, decision-making power if like, your condition is such that you're still, like, able to think clearly and stuff. Like, I was always able to think clearly when I was hospitalized for depression before. Like, I never had like, episodes of psychosis, or like, I'm not sure what else would, like, preclude you from being able to make your own decisions while in hospital, but I like always maintained like my clear thinking. Like, was it rational? Not really, but like I was always like aware of what I was thinking, and I was like always like in touch with reality. But when I was on an involuntary hold, the nurses, they treated me as though I didn't have decision making power, and like they made me take medicine that I didn't want to take. And when I asked questions about the medicine, like they would just like command me to take it and to stop like asking questions. And they would give me threats. They'd be like, well, if you don't take this medication by mouth, like we're going to give you an injection, or we're going to like put you in restraints if you don't like take this medicine and stuff, which I thought that was like really, really horrible. And the treatment that I got while in hospital while under an involuntary hold versus like on my own free will because I wanted to be there to get better, the treatment was so different. And yeah, so like all these thoughts and like memories from like a few years ago came back to mind today when I was in class and lecture. Lecture and lab. So I just sort of wanted to vent and like just talk about that. And yeah, and I guess if any of you who are watching have been admitted involuntarily to a hospital before and you have like negative memories from that, know that you're not alone, because I also have negative memories from that. And for the most part, like I think that I've moved on. But it's just sometimes there are sort of triggering things that just make me think about like that time in my life. And today was just one of those days. So I just sort of wanted to talk it out. Yes. I think that's all. So bye guys.